My name's Caitlin McNeil. I'm the Director of Health Services for the Opaskwayak Health Authority. Welcome to the Beatrice Wilson Health Centre. We offer 63 programs and services, and we have about 170 staff that work out of 2 locations and at a care home in the community. Our health center is built on the idea that it's important for us to incorporate Cree culture into healthcare service delivery. So one of the things that was prioritized when the building opened was to have a space for traditional healing and medicine, in addition to best practice, evidence-based healthcare services. So this is our traditional room here. This is the one room in the building where people are able to smudge, which is a ceremony that's important in Cree culture for grounding yourself and resetting and just making sure you're moving forward and doing things with good intention. So back here is our clinical area. So the majority of time we run a primary care clinic here, and we also offer a number of specialist clinics based on the physician's availability to come up. So we save a significant amount of medical transportation funding by bringing specialists to the community. So right now we have an OBGYN that comes over from the Northern Health Region. We have an internal medicine specialist, sports medicine, pediatrics, an asthma and allergy team. And so they come up every few months on a rotating basis. Hopefully long term, the dream is to have that be a standard level of access that all First Nations should have, right? It doesn't matter where you live, we all deserve access to primary care providers. The burden to patients and to the system in having to send 20 people down to Winnipeg to see a particular specialist rather than having that specialist come up for maybe 2 days, it just makes financial sense and ethical sense at the same time. We just continue to try to pursue as many opportunities as we can to provide care to the community. The vision that the leadership and the health directors of the past have had, this has been decades of work. And so seeing it all come together and being able to offer services that aren't normally found in a First Nation community is very rewarding.